Once all the information is gathered and a determination of the potential underlying cause of the problem is made, the appropriate functional rehabilitation program that best addresses the problem is then implemented. So what I'd like to do is to take you through a medical exercise training program for a particular diagnostic classification of back pain. You'll remember from step 3 that I classify back pain into 4 different diagnostic categories. There's the forward pelvis syndrome, the backward pelvis syndrome, the high pelvis syndrome, and the forward head syndrome. And the diagnostic classification that I'd like to go over with you today is the backward pelvis syndrome. And incidentally, when we're making a diagnosis about for a particular patient and their particular condition, it's not unusual. In fact, it's very likely that they will have 2 and oftentimes 3 of these syndromes that are superimposed over one another. That's where back pain becomes a little bit more complicated in how to treat it effectively. Most people will focus only on one thing and not look at the big picture. But what I do is take you through a sequential set of steps to where we identify all of the problems associated with your particular condition and then address each one of them in a logical order. So for the sake of this presentation, we're just going to take a look at the backward pelvis syndrome. So backward pelvis syndrome has several different things associated with it. First of all, you'll notice that there's tight chest muscles, there are tight abdominal muscles, there are weak hip flexors, and those are the muscles that will move your knee toward your chest. There are tight quadriceps muscles. Those are the muscles on the front side of the thigh. Tight calf muscles, tight hamstrings, tight buttocks muscles. The pelvis itself is oriented in a backward direction, meaning that the back of the pelvis is lower than the front of the pelvis. And then there's a flattening of the lumbar curve, so there's no curvature in the lower back. And then finally, there's weakness in the muscles in the upper back. So what we're going to do is I'm going to take you through the exact medical exercise training program that I would use to address these specific problems. The first activity is what I refer to as the corner stretch. It's an exercise that we will do to improve the flexibility of the chest muscles. So we'll have the patient put their hands on the wall, standing in a corner, and then just lean into the corner to improve the flexibility of the chest. We have specific instructions on how to accomplish this, how long to hold each stretch, and how many times to do it with each one of the exercises. The next exercise is what I refer to as the reverse wall push-up. So standing in a corner, you're going to place your elbows on the wall, and then you're going to push yourself out from the corner. Now, this engages the muscles in the upper back that are weak, that we identified as part of the backward pelvis syndrome. So we want to begin to exercise or strengthen these muscles. Again, the number of repetitions, the number of sets, how often to do it every day is all in the exercise prescription that we will provide. Next, we have an exercise that does a couple of things. Number one, it will start to restore some of the mobility in the low back and start to restore some of that curvature that is lost in the lower back, and then also it begins to stretch some of the abdominal musculature. If you have difficulty with this particular activity, there's a different way of performing this. You can lay over a bolster or a towel roll and then just bring your arms directly overhead. That will stretch the abdominal muscles and then also restore some of that curvature in the lower back that is lost. If you want to get a little bit more stretch from or of the abdominals, then all you have to do is just straighten out your legs, and you can improve that flexibility of the abdominal muscles just by straightening out the legs. To restore some of the lost mobility and some of that lower lumbar curve, a standing back bend stretch is prescribed. Again, we tell you how long to hold this, how many times to do it, how many times a day to do it. That's all in your customized exercise prescription. To strengthen the quadriceps, or the muscles on the front side of the thigh, it's very simple to do. All you need to do is find something that you can step up on. Most people have a stool. A lot of people have stairs in their homes or a step outside, and it's just a matter of taking a step up, raising up using your leg muscles, and then slowly lowering using the leg muscles. And that's a very effective way of beginning a retraining activity for the quadriceps muscle itself. To strengthen the hip flexors, those are the muscles that bring the knee toward the chest, what you would do is just sit and then place a small ankle weight at the end of your thigh. And again, we tell you how much weight to use, how many times to do the activity, how many times a day, really dose it out for you. And all you do with this exercise is just bring your knee toward the ceiling, and that will begin to engage those hip flexors and allow you to strengthen those muscles themselves. To stretch the hamstrings, you'll see a lot of different variations of how people stretch their hamstrings. We take a very scientific approach in terms of the muscle attachment. Remember, the hamstrings run on the back side of the thigh, so we want to improve that flexibility. Improving the flexibility of the hamstrings can play a dramatic role in reducing your back pain, because improved hamstring flexibility will decrease some of the compression in the lower back. And then finally, to stretch the buttocks, you'll see this exercise often prescribed. And this is an exercise, in this case, she's stretching her left buttocks muscle and just bringing that hip up toward the chest, which is going to stretch the buttocks here on her left side. So again, the keys to success are in step 1. We showed you how to understand how much back pain is affecting your life. What is back pain taking away from you right now? And that was, for some of you, I know, was a very eye-opening experience, because back pain, it's not just about the pain, it's about what it prevents you from doing, from enjoying your life. Secondly, we showed you how to get very clear on where your symptoms are located and the behavior of those symptoms. Step 3 is that we showed you the different diagnostic classifications for back pain. We're going to take your back pain and we're going to classify it into a particular category. That helps us then go into step 4, which is to treat the underlying problem. And then ultimately, we want to help you prevent the problem from coming back, and medical research has again shown that people that follow a very prescribed maintenance program have less than a 10% chance of the pain recurring. And that, again, has been shown through scientific research that if you follow a maintenance program, 90% of the time, you're not going to have a recurrence of back pain. And I like those odds. So, at this point, I'd like to thank you for giving us the opportunity to help you understand your back pain just a little better. If you'd like more specific information on how to eliminate your sciatica, neck pain, or back pain quickly, easily, and safely, then click the button below and begin feeling better today. All good health to you, and I do hope our paths cross soon and often.